and the Chief Medical Officer. Good morning to ladies and gentlemen of the media and to all persons listening or viewing wherever you are on this rainy morning, Monday, 6th July. Ladies and gentlemen, I want to pick up where I left off on Saturday. On Saturday, we mentioned on this platform that WHO has advised that the world is now in the second peak of the first wave. That's a very telling statement. Today, PAHO, Dr. Carissa Etienne, as of yesterday, sent out another news release. And I want to deal with some elements of that news release this morning because I think it is important that as a country we remember we are still in the middle of a global pandemic. Ladies and gentlemen, the daily number of new cases keeps rising. We would have discussed here at one time it was 150,000 cases on average. Then it went up to 175,000 cases on average. Now we are starting to touch on a consistent basis 200,000 new cases per day. The pandemic shows no signs of slowing down. Dr. Etienne has advised that as countries in the Americas, we should learn to and prepare to manage this COVID crisis that we are in for the next 2 years. So we are in July 2020. Their estimation is that we have to start to live with this for the next 2 years until July 2022. Another important paragraph of the release that was sent out is this. And we are quoting these to urge people to understand the reasons why Minister Young and myself keep saying we simply can't open the borders. And I want to quote, "Though we rejoice when one country successfully flattens its COVID-19 epidemic curve, and Trinidad and Tobago, we have done that. We were never overwhelmed. We successfully flattened our curve." She goes on to say, "The risk of emergence will always remain unless we flatten the curve regionally and globally." What Dr. Etienne is saying, in other words, is that countries like Trinidad and Tobago that has flattened its curve cannot be lulled into a sense of complacency because of that. We must be vigilant and continue to hope that the rest of the countries around us also flatten their curves. 2 countries in the Americas are now reporting COVID-19 cases of 1 million plus. Countries near to us. There is widespread transmission in Central America. There is widespread transmission in one country in North America. And Dr. Etienne goes on to say, we must be realistic about the future. We must be realistic about the future. And we must adjust to a new way of life and redefine our sense of normal. What does that mean for Trinidad and Tobago? On Saturday, we would have indicated here that the next big prize in the reopening of our economy is the reopening of schools in September. Let's focus on that prize. Because if we do things now in July and August, that puts that opening at risk. Think about the ripple effects if we can't open schools. It means children are stuck at home again. It means they miss schooling again. But it's not only the education they will miss. They will miss the camaraderie with their friends, the whole social interaction that goes on in school. It means teachers will still have to be home. It means public transport can't get up to 100%. It means the economy that depends on movement of school children, thousands of teachers will suffer. The prize that we have in mind as a government is the reopening of schools. That is why we must not risk that by taking short-term populist decisions, as hard as they may be. Dr. Etienne goes on to say, in the absence of an effective vaccine or effective treatment, we expect the next 2 years, the region of the Americas will experience recurring COVID-19 outbreaks, which will be interspersed with periods of limited transmission. In other words, what she is saying, for the next 2 years where she stands now at PAHO, we are going to be seesawing, up and down. Up, cases, down, limited transmission, and you get lulled into that sense of complacency. So, ladies and gentlemen, this is just the warnings, the advice I am putting in front of the national population this morning. This is the advice coming from PAHO, that we have to learn to live with this thing for another 2 years and learn to live with a series of peaks and troughs. So far, Trinidad and Tobago, led by the Honorable Prime Minister, has done what is regarded as an amazing job. But we cannot risk these gains by being reckless with how we conduct ourselves over the next couple of months as we look forward, as I say, to our next prize, which is the opening of schools. So, Minister Cox, with that piece of advice from PAHO, I want to thank you for the opportunity, and I hand over to you.
Thank you, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Good morning. Honorable Ministers, members of the media, members of the viewing and listening public, the clinical update for Monday, the 6th of July 2020 is as follows. The total number of tests done between the public sector, UE, and the Caribbean Public Health Agency stands now at 5,555. Number of unique patient tests, 4,171. Number of repeated tests, 1,384. The total number of community deaths done in the public sector, 1,965. And as promised, on the Mondays, I am reporting the private sector tests done as of the 3rd of July, which was last week Friday, stands now at 1,245. Total number of cases, as you would have noted over the weekend, rose by 3 to go up to 133. All 3 individuals coming from the Enchantment of the Seas cohort. Total number of discharges has gone up as of yesterday by 2 to 117. The number of deaths remain at 8. Total number of hospitalized patients at the Cora facility remain now stand at 8. In terms of the quarantine facilities, we have 405 persons quarantined throughout the parallel system at this time. So at the Cora facility, we have 24 individuals. Hoover Medical and Multi-Training Facility, 141. At the UE St. Augustine Debe Penal Campus, we have 18 individuals. At the Chancellor Hotel, 13. Tacarigua Center, we have 40 individuals. The healthcare workers at the Napa, 21. At the Home of Football, we have no one at this time. At the Brooklyn Center, there are 31 individuals. In Balanja, we have 42. UE Freedom Hall, we have the repatriated students from Barbados awaiting their re-swab today. We have 45 individuals. At Cascadia, there are 14. And Vision and Mission, there are 15. By way of the repeated tests that we were doing on the Enchantment of the Sea passengers, we have received thus far 160 out of the 293 unique tests for that particular group. We expect to receive the remaining from the Caribbean Public Health Agency during the course of today, and once all of the analyses are received, we will make a decision going forward for that particular group. Thank you, Minister Cox.
Thank you very much. At this time, the Minister of National Security, the Honorable Stuart Young, will speak about public health regulations and borders. Minister Young.
Thank you very much, Minister Cox, Minister Dial Singh, Chief Medical Officer, members of the media, wider viewing and listening public, not only in Trinidad and Tobago, but our diaspora scattered all over the world. Thank you all very much. This morning, I'd like to start by focusing on what we've been doing with respect to the borders, and just to bring us into context, to remind us that the reason that we've been able to return to fairly normal lifestyle and what we called a few weeks ago the new normal in Trinidad and Tobago is because of the good work that had been done previously, and the way that we've handled this pandemic in Trinidad and Tobago, making Trinidad and Tobago a somewhat safer haven than many other jurisdictions in the world. The only thing that maintains this and allows us, the population in Trinidad and Tobago, to continue having fairly normal lives and back to normal, the reopening of the economy, the expansion of business on a daily basis, is the border control. By us keeping our borders closed and continuing to manage the entrance of persons back into Trinidad and Tobago, it has allowed the population of Trinidad and Tobago to get back to some life as normal. This is the most critical component going forward with respect to us continuing to protect the population here in Trinidad and Tobago. And we cannot overemphasize or underemphasize that. It is a very difficult task with us managing it, because we do have a lot of empathy for all of our nationals who are outside making their applications for approval to come back into Trinidad and Tobago, and we're managing it as quickly as we can. You would have heard the CMO, the Minister of Health, talk about in the last few weeks how we've been managing. We still have over 500 persons currently under state quarantine, and what happens when you have cases that are testing positive in the middle of that. We're continuously looking at the reintroduction and the opening and approval process for persons to return to Trinidad and Tobago. We've repatriated nationals from Venezuela, Suriname, Guyana, or cruise ship workers, which were just under 1,000. People seem to forget these things. A number of our oil and gas workers from around the world, or UE students from Jamaica and Barbados. And we've also been granting approval for certain sick persons to return to Trinidad, again on a very controlled and managed basis. Today, we're bringing in persons from Cuba, not only our students, but Caribbean Airlines is doing a flight to Cuba and St. Martin today, and we're looking at 29 persons from Cuba and about 17 persons from St. Martin have been granted approvals. Some of these persons in St. Martin, I'll let you all know, are MIC workers who have been there since March, and we've been asking them continue to stay in place. So just to let our nationals know across the world, we do feel for you. We do understand the difficulties. We all have persons outside, personal to us, who would like to come in but can't come in as we continue to manage this process. So today, we're bringing back persons from Cuba and St. Martin. The next influx we're looking at is Caribbean Airlines is likely to arrange a repatriation flight to bring back persons from Grenada. This will include some of the students in Grenada. All of them will be granted exemptions. But just to let the public know, even when we grant these exemptions, there are persons who still choose to stay in place. So the next step for us is Grenada. We have also been looking at the United Kingdom and Canada as the next shortly, and there will be exemptions granted to these two jurisdictions this week. And I just want to give the population an idea at this stage. We are receiving a number of applications for exemptions for persons to come into Trinidad and Tobago. Each application may be one person or maybe a family. So the application is only indicative of a physical application coming to us. We have some applications with as much as 22 persons. We have some with families of 5, and it goes like that. Currently, just to give you an idea, we have 924 applications for persons to come in from the United States. Multiply that exponentially. We have 175 from Canada, 146 from the United Kingdom, 55 from other areas in Europe, 50 from Middle Eastern countries, and 68 from Far East countries. And that is only those categories that I've identified. We have between 2,500 to 3,000 applications for exemption to come in currently in the system. We can only manage this by balancing the persons who are returning with our state quarantine facilities. We are looking, I'm in the middle of discussions with the Ministry of Health, at adding an additional state supervised quarantine at a hotel to allow us here opportunity to bring home more persons. So the next ones that we're looking at are Grenada. We're then looking at Canada. Canada, because we have a number of flights going out starting from today, I believe, or in the next couple of days, taking the farmers who want to go and work as seasonal farmers in Canada out. The first flight is not going to bring anyone back, but we are looking at the second Caribbean Airlines flight allowing a number of persons back. You will be granted exemptions and then touch base with Caribbean Airlines to be able to come home. With respect to the United Kingdom and others in Europe, we're going to be doing the same thing. We have a way, very difficult to try and prioritize. Everyone is not going to be able to come back on these first few flights, but it is showing that there is going to be this repatriation of persons who are currently in these jurisdictions. Bear with us. We know your patience has run low. We know how difficult it is, but the reason for this is we have to balance the numbers with those who are currently the ability or capacity in our public healthcare system to state quarantine, and we're looking to increase on the state supervised quarantine side. So what you will be receiving is an email saying that you've been granted an exemption, and we'll be asking you to indicate whether you'd be prepared to enter state supervised quarantine at one of the hotels that has been approved by the Ministry of Health. And if you are, that then allows more space in the state quarantine side. And it is no pressure on anyone. This is how we're managing the numbers for persons to return. I'd like to make a point at this stage that we've made before. The Prime Minister has referred to it, and it is worth repeating and important to repeat. The government's policy is not to permit neighboring islands, neighboring countries to be used as jumping points and launching pads into Trinidad and Tobago. Obviously, people who may be in far off places may want, as other countries open up, to make their way there, but understand it's not going to be allowed as an immediate jumping point and launching pad into Trinidad and Tobago once we continue to maintain our border control. Another point that arose over the weekend that I'd like to draw to the population's attention: every single person who is allowed to enter Trinidad and Tobago is being granted approval to do so by the Ministry of National Security. There is no known case, and I have actually launched an investigation to look into whether persons have been able to enter via aircraft into Trinidad without approval. There is no such case. There are certain persons making that allegation. Another point I'd like to make is persons should not be fooled, especially those persons outside of Trinidad and Tobago, by charter companies or persons holding themselves out as having a charter flight, that there's been a blanket approval granted for a charter flight for persons to come in Trinidad and Tobago. That is not how the exemption system is working. Individuals are granted exemptions and then they make the arrangements to come back. If a group of individuals who have been granted exemption or approval to come in then form themselves as a group and charter a flight to come in, that is something different. But there is no one authorized to say that they can get exemption for you, get approval for you, and therefore you should come onto their charter plane because you will be granted approval and an exemption to return to Trinidad and Tobago. It simply does not work that way. There have also been a number of persons who have been permitted exemptions to come back in for specific health reasons. We're managing that process and running that as well, looking at the applications as we go through them. So this is just a reminder, there is no charter company out there. We are working with Caribbean Airlines. We've run a number of flights with them, repatriation flights, and those are the flights that are approved. But you would get your exemption. You'd be notified by the Ministry of National Security in advance that you've been granted an exemption. For example, the persons in Grenada, and they would be contacted. The persons we're bringing back today from Cuba and St. Martin. There is no charter company anywhere in the world that has the authority or the approval of the Ministry of National Security to bring persons back into Trinidad and Tobago without the individuals getting our prior approval. The last thing I'd like to say with respect to departure from Trinidad and Tobago, everyone who wants to depart Trinidad and Tobago is being permitted to do so. Of course, you make your own arrangements. I've asked for a dedicated email to be set up for that purpose, so those applications aren't mixed up with the applications for persons to enter Trinidad and Tobago. All persons who want to leave are being granted approval to leave. We have a number of people looking at, for students looking to return to their universities abroad and just other persons in general. From today, please use the following email address if you're looking to depart Trinidad and Tobago. It is depart exemption, DEPART exemption, EXEMPTION at MNS, Ministry of National Security, .gov.tt. We will put out a release later on today clarifying this email and just so everyone knows this is the email when you want to depart Trinidad and Tobago. When everyone wants to depart, you are going to be granted exemption and you make your way out. There are no commercial flights that are being granted approval to enter Trinidad and Tobago, either for the rest of this month or anytime soon in the future. We have not as yet granted approval for any commercial flights. We are working with CAL for the flights that I've just told you all about. So the next group of Canadian farmers that are going up to Canada, we will be giving certain persons exemptions to come back on that flight. And we're looking at the same with respect to the United Kingdom and then other jurisdictions. So please stay tuned, stay in touch. We will continue to provide the information. This is necessary as we balance the state quarantine facilities and the state supervised quarantine facilities with what we can manage in our public health care system to continue to keep the population safe here in Trinidad and Tobago. Thank you very much, Minister Cox.
Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. And we want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the poll and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. TV6.
Hi, good morning, everyone.
Morning.
Nicholas Suchman Singh here from TV6. Minister Young, just for clarity, there are persons who are depending on meal from Canada, like pensioners. Some have claimed that they haven't been able to receive their pensions for the past 4 months. Will Canada or will meal be delivered to Trinidad as we are now allowing Canadians to traverse between countries or persons, or has that always been in place through the COVID period?
Thank you very much. Mail, as far as I'm aware, has continued throughout the whole period. As you're aware, we continue to allow cargo planes in and everything related to that. So I'm not quite sure what happened there. I know at one stage TT Post at the beginning of our stay-at-home period in Trinidad and Tobago was not delivering mail, but I think that has been sorted out by now. That is something I can look into. But as far as I'm aware, there has not been any prevention of mail getting to Trinidad and Tobago. Now, and it will come up a bit, may come up a bit later on, in my reaching out to certain consulates of Trinidad and Tobago all over the world, I was reminded that understanding every jurisdiction, they too have had their equivalent of stay-at-home orders. They've had their own regulations. So, for example, in Canada, I was being reminded by the Canadian Consulate this morning, the immigration officers there, that they were under restrictions as being able to go to work. So each jurisdiction, Canada, the United Kingdom, other countries, may have had their own regulations in place that may have restricted what their offices were doing. So government offices in some of these other jurisdictions would have been like Trinidad and Tobago, stay at home and persons not. So it wasn't business as usual. So maybe that is as a result of what was going on in the various jurisdictions.
Thank you. Thank you, Minister. 98.1.
And very good morning to the panel. Stephen Cummings, 98.1 FM.
Morning.
And just want to go quickly with my 2 questions. One for the Minister of Health, Minister Dayal Singh. Well, I'll ask that question first. Minister, you spoke about a 2-year timeline. Apparently, it appears as though we may be living with COVID for the next 2 years. I'm wondering if this is an indication that even our borders may be, we may not have access to opening our borders under 2 years. I'm not sure if you can probably address that, or maybe even the Minister of National Security. And Dr. Parasaram, at a previous media conference on the 6th of July, you listed a number of designated facilities for COVID-19 community testing: St. James, El Socorro, St. Joseph, Chaguanas, Mayaro, Siparia, Sandy Grande, and Pleasantville. There were no facilities represented at that time on the list for Tobago. And could you also advise on the testing centers for Tobago? Thank you.
Okay, so thank you, Stephen. And I think that's a very worthwhile question to be posed. PAHO is advising countries that until and unless you have an effective vaccine, not only effective, safe, reliable, widely available, or a therapeutic agent to treat, we have to assume that we are living with this virus, with these peaks and valleys of infections going up and down for the next 2 years. No one here, and I don't think even the Minister of National Security, can predict when the actual borders are going to be open. But let me give you some examples around the world. Australia announced, I think about a month ago, that they will not be opening their borders until early 2021. They made a very clear, definite statement. Australia is not opening their borders until 2021. That's a bigger country, more resources. We're a small country with limited resources, and yes, we have done well. So there is no way I can tell you when the borders are going to be open, but what we can say is that until the world, until the globe gets a handle on getting decreasing rates of infection, that discussion is going to be premature. And what is scary is the statistic I always give at the start of these things. The daily number of new cases, the average number of new cases per day is seeing no downward trend. As a matter of fact, you are seeing the opposite. A month ago, it was 150,000 cases on average per day. Then it went up to 175,000 cases per day. Now it's 200,000 cases per day. So based on that alone, it is virtually impossible as leading the Ministry of Health to advise either the Minister of National Security or the Honorable Prime Minister that our borders should be open as they were before. So I hope that answers your question.
Thank you. CMO?
Yes. Hi. In terms of the centers at Tobago, I believe a press release was sent out from the communications unit of the TRHA on the 13th of May, which indicated their centers, and I just reiterate what they said. They said the walk-in centers are at A.N Health Center, Roxborough Health Center, Scarborough Health Center, Scarborough General Hospital. All of these have a walk-in service. The Green Room, green-colored building in the Old Scarborough Regional Hospital, Fort King George, by appointment only. You call 800-HEAL. And I think the Delaford Health Center, by appointment only, 800-HEAL as well. So they have a slightly different, they have a larger number of health centers that have been designated. Mind you, in Trinidad and Tobago, although we have one main designated center, if you have a flu-like illness and you go to any of the other health centers in the country, you will still be swabbed if they think that you are suspect. So that will still continue. I had visited myself the El Socorro Health Center on Thursday, I believe, last week, to see firsthand what was happening in terms of the swabbing at that center, because the figures we are getting nationally in terms of surveillance seems to still be lower by way of viral illness. And when I visited, really, and there were no patients in the screening center for viral illness at that time. The nurses and the physicians indicated that the numbers have been extremely low of persons coming into the facility with any viral illness, which is very unusual. And of course, it continues to be a side effect, not an untoward side effect, but a benefit of having the public health measures in place.
Thank you, Dr. Parasaram. AZP News.
Good afternoon, or good morning, I should say, to all on the panel, and Pamela Ramcharan, azpnews.com. My question is to Minister Diyal Singh. You mentioned about Australia saying that they are not opening their borders until early. saw recently being headlined on the news is Barbados will begin opening the borders. Barbados, quite a smaller country than Australia, starting from July 12th. However, there are some restrictions and so in place. Is that something that TNT can consider? Because we hear about PAHO, what they're saying about recurring cases of corona for the next 2 years. Citizens that are stranded abroad do not want to hear, yes, good information, but when? Can you at least give a timeline to these citizens that are stranded? They are running out of money, and some of them are even having to move from the place that they're staying, their hotels and so on. So even an indication, giving people hope as to an idea of when they can get home. And my second question is to the National Security Minister. With regards to the elections, the date of elections has been announced. We have these citizens, they are abroad, some of them, of course, being disenfranchised. Is this an issue for the ministry, even for the government, for the elections, because it will impact the elections that are coming up on August 10th? Is the National Security Ministry looking to expedite the process to bring citizens home?
Okay, who will take the
Yeah, so I will go first. Thank you very much, Pamela. Since we've been having these press conferences 3 or 4 months now, we always say from these press conferences, every country has to do its own risk assessment, and every country, based on its socio-economic factors, its national security priorities, must make decisions based on what their priorities are. Trinidad and Tobago is no different. In response to Mr. Cummins' question, there is no way right now that, as Minister of Health, that we could say the borders will be open on XYZ date. What we can tell persons is that the same thing that the Minister of National Security said. You apply for exemptions to come in. And so far, how many thousands have come in? A couple thousand.
Yeah,
I don't have the exact figure. Whether it's students in Jamaica, students in Barbados, the partially blind man from St. Lucia, the cancer patients, from Prince to Pauper, have been allowed to come in a managed way to protect 1.4 million people and to protect our economy and our socio-economic fabric. So let that process continue. Pamela, we understand, we empathize, we sympathize with persons abroad. But this is a global pandemic, Pamela, that has killed 537,707 persons. If we give in to the pressures, then our death tally to date is 8, will explode. So the exemptions to come in, as applied by the Honorable Minister of National Security, is working in the best interest of Trinidad and Tobago. Individuals may feel disenfranchised. I could understand that. It's a natural human reaction. This is there are people around the world stranded in countries who can't go home to witness the burial of their mothers. This is traumatic. Or people stranded around the world can't go home to witness the birth of their first child. Everybody around the world is faced with this situation. We empathize and we sympathize, but at a governmental level, we have a bigger picture to look at, which is the protection of lives, our economy of 1.4 million persons. So let them continue to apply to the Minister of National Security for the exemptions. Thank you very much.
Thank you very much. To answer the second question, it really is built on the platform of what the Minister of Health just said. All of these decisions with the management of COVID are based on expert advice from our public health officials. Right now, our public health officials are very, very clear, and I support them personally because it makes a lot of sense to me that the borders have to remain closed. This is not about the disenfranchisement of anyone, because left up to us, we would like everyone to be back here in Trinidad and Tobago. This is simply about the protection of the population who are here in Trinidad and Tobago from a global pandemic that is raging. When you look at what is going on in the United States on a daily basis with the growing numbers, the climbing numbers, which is one of our closest allies, one of the countries we're closest to, it is frightening. The same thing is going on in some countries right across from the Gulf from us in South America. So right now, all of our decisions as a government with respect to how we manage COVID, how we manage the borders, are being driven by public health expert advice, medical public health expert advice. As the Prime Minister said on Friday when asked the same question, this is not about voters, this is not about the election, this is not about disenfranchising persons, because that's certainly not the intention. It's simply about protection of lives in a global pandemic. So at the end of the day, the borders remain closed. We continue to manage as quickly as we can, as we've tried to explain over and over. It's a balancing of our resources, of persons who can come in, along with the capacity that our public health care system can handle. And I'd just like to add, as was pointed out, understand that all of these state quarantine facilities where we're taking our nationals back into, it's us, the taxpayers, you, the taxpayers, paying for our nationals to be quarantined as we continue to get them back here.
Let me just emphasize a couple of points. There are countries in the world, and I wouldn't call the countries, where the COVID pandemic is so great that there's a waiting line, Minister Cox and Minister Young, there's a waiting line to get into an ICU unit. You have ICUs at 120% capacity. You have persons, pregnant women, who are in a waiting line to get into a COVID ward for pregnancy. That is what countries are faced with because they did not manage this pandemic. We don't have that. Our curve is flat. But as we said, we cannot make short-term decisions until the world has flattened the curve. We have to continue to jealously protect the gains we have made. We don't want a situation where we give in to pressure, you open the borders, and then our ICUs are filled, as in other countries, where people are dying waiting to go on a ventilator. Pregnant women are dying waiting to get into a ward. There's a case in another country, a big country, where people are being shuttled from A&E to A&E. They went to 80 accident and emergencies and died in an ambulance. These are the gains that we have to protect. And we understand how frustrating this is. We understand. But when you're in a position of leadership, as the Prime Minister, as Minister Young and myself, you have a much bigger vista to consider when you make decisions. Thank you very much for the question.
Thank you very much. Minister, I believe that one of the areas she's focused on was impending elections.
Yeah, thank you, Minister Cox. I did refer to the elections. The point that I was making is that this decision is, and I refer to what the Prime Minister said in Parliament on Friday, the decision with respect to the borders, the decision with respect to how we manage COVID-19 is not one driven by elections. So at the end of the day, as I said, this is not an attempt by any stretch of the imagination to disenfranchise anyone from being able to cast their vote in the elections. This is quite simply about taking advice from our medical public health care experts and protecting the population, the 1.4 million people who are currently here in Trinidad and Tobago, from the global pandemic and the spread of the COVID-19 virus.
Okay, thank you. That's very clear. Guardian Media Limited.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Good morning. I have two questions this morning, one for the CMO and one for the Minister of National Security. So CMO, firstly, one of the patients who tested positive from the Enchantment of the Sea took to social media yesterday, I believe it was, and was raising a point, and she said that her PCR test, a number of tests were done on her, numbers of PCR tests were done, and each one, once it started off positive, then it went negative, then it went positive, and back and forth like that a couple of times. So I want to know if you could just clarify how is that possible, or if that is possible at all. And to the Minister of National Security, someone reached out to me, and I think it's a bit of an interesting case. The person is currently studying in Miami and wants an exemption to come into the country. But what makes it interesting, I believe, is you all have said multiple times that it's nationals you all are allowing the exemptions to come in. But with this person, she was born in Guyana, and from the age of 2 has been living in Trinidad and Tobago under a CARICOM certificate. So she went to school here and everything, and is now in Miami and is seeking an exemption. So with cases like this, Minister Young, is this something that you all would contemplate allowing them the exemption, or is it still strictly just nationals?
Okay, I'll let the CMO go first, please.
So yes, so when we have positive patients, we have, as you remember, we have a robust discharge clinical criteria, and that is, as we said early on, so you're 7 days asymptomatic, we do your first test. If that is negative, then we do a second test 24 hours after. Again, if it's negative, you're discharged home. What we have noticed throughout the course of the cases that we had in Trinidad, there are a number of individuals that would have come back negative in their first test after 7 days and then had a positive thereafter. And it really is a very unusual sort of characteristic of this particular virus that we noted. The virologist had said the same thing, that is an unusual characteristic, that we have people going negative and then positive. Even the cases that we actually have in Cora at this point, we have a couple examples that went through that exact scenario, where we got a negative and they got a positive. There are even cases where you got a second negative after a positive, and then you got another negative and then another positive again. So some people believe that it is late shedding of the viral particles, meaning that some of the RNA is being shed, however, they are not infectious. But out of an abundance of caution, we want to make sure that we have the 2 negatives 24 hours apart, and we stick with our clinical guidelines on the off chance that it may be infective, and we don't want to risk the spread to the population. So we have noted it in Trinidad. It has been noted in the research literature across the globe, and it's something that is very peculiar to this virus.
Thank you.
Thank you very much, Minister Cox. Thank you, Mr. Khan, for that question. I must tell you that in the time that I've been the Minister of National Security, I have not heard of a case such as the one you've just said. Normally with the CARICOM certificates, they're CARICOM skills certificates, and it's for adults. So to say there's someone from the age of 2 had a CARICOM certificate, not that I'm doubting it, I will look into it. I'd also be surprised if a person from the age of 2 who has been living in Trinidad and Tobago, based on what you've just said, has not applied for permanent residency or doesn't have a permanent residency stamp in their passport. But right now, we continue to maintain as nationals of Trinidad and Tobago, which include those who have been granted permanent residency. But if there is a category such as what you've just described, it is something I'd look into as well and consider on a case-by-case basis. But I'm not aware of that category that you've described.
Thank you. Newsday.
Good morning.
Morning.
Good morning.
Good morning.
Morning.
Good morning. We are hearing you.
The first question I have is for the CMO. We've received reports and seen videos and photos where political candidates are not following the public health regulations while campaigning. Example, they're walking in groups larger than 25, not observing social distancing, wearing masks improperly, if at all, hugging people, etc. Is there anything you'd like to say to these candidates?
Okay,
and the second question is for Minister Young. You had said last week that students from India would be in the next group of people to be granted exemptions. I wanted to find out if the group of 9 footballers who play in the Indian League who are stranded in India would be granted exceptions and brought home at the same time.
Okay, CMO.
No, I mean, so generally the only thing that is under regulation is the number of people that can congregate in a public space, which is 25. And I think just a reminder that, the number still stands at 25. The other bits about not having social distance, mask wearing, etc., we have maintained that is not a regulation at this point. However, it's just a reminder that, it should be maintained at 25.
Thank you, Mr. Young.
Thank you very much, Minister Cox. Yes, the students of India, as we had indicated, last week, have been granted exemption, we've been asking them to reach out to us as individuals. What we've had is persons trying to reach out in terms of groups. So the students from India got mixed up with persons from all over the world, including the United Kingdom, etc. But we're sending out a message again, the students in India, you are going to be granted your exemptions, make your way home. With respect to the footballers, as much as I would love to at this stage tell everyone who's applying you can come home, as I'm at pains to say right now what we're doing is we're balancing numbers. And that's why, for example, persons who think they can secure a flight and they want to fly in tomorrow or on Wednesday, it simply can't work that way, because what we've done is we've planned a process based on the numbers of spaces that we have available in state quarantine and state supervised quarantine, and we've booked, in inverted commas, those spaces to persons we've granted exemptions. So the footballers, etc., we are looking at it, and when we start to get these openings, we also want to deal with the persons in the United States, and it's a constant balancing. So we will get to the persons, the footballers who are in India, but they are in a different category, because right now the students who are in India, a lot of them are based on scholarship, and you have their universities or the government of India offering on asking for them to be brought back home.
Minister Young, while you're at it, there's a question concerning the status of the renewal of passports at the consulate offices in Toronto.
Thank you very much, Minister Cox. So with respect to some of our consulates or high commissions, so for example, Toronto High Commission, the consulate in Miami, the embassy in Washington, D.C., and some of these, what has happened is, as I referred to a short while ago, each of those countries had their own regulations in place, had their own laws in place. So workers may have been told, the governments in those jurisdictions may have told persons, please stay at home, and we had to close those embassies, those consulates, etc., and it was not business as usual. I've reached out to the Chief Immigration Officer this morning, and it is becoming business as usual. So they're going to start accepting once again the applications that will be posted in. So for each consulate and each country, there are going to be different procedures in place, and now the diplomatic pouches have started to come back, because of course the applications and the passports are sent via the diplomatic pouches. So the Ministry of Foreign and CARICOM Affairs has restarted that process, but for each jurisdiction they would have been bound by the various applicable laws in that jurisdiction. So Toronto, I'm assured, are about to restart, but what I was told is in that particular province they still had the sort of stay-at-home measures and persons weren't allowed back to work. So some of these consulates and embassies and high commissions of Trinidad and Tobago are now starting to reopen and get back to a couple days a week and this type of thing. Each of them will do their own reaching out, and if anything, I will ask that the Ministry of Foreign and CARICOM Affairs and the Ministry of National Security get some press releases out, so persons know what are going on in each.
Yes, definitely. Express?
Good morning.
Morning.
Good morning.
Oh, morning. Morning, Minister, CMO, everyone. I have two questions I think would be basically for Minister Young, and just a sort of confirmation of something Minister Young said earlier, which I hope Minister Cox will not count as a question. Minister Young, just to go back to some figures you called earlier, just to make sure, you said there were between 2,500 to 3,000 exemption applications currently in the system. So I just wanted to double check that number. You called some other figures, 50 from the Middle East, 55 from Europe, etc., European Union, etc. So for the benefit of other listeners, those numbers sound not small by any means, but the impression is there that thousands and thousands and thousands of applications are in the system, and so it's creating a little bit of not hopelessness, but close to for people who wonder, where am I on that list? So if you would just confirm those figures first.
Understood.
Minister Young, also you mentioned the United States in the context of their rising figures, and we know that the US is being put in a naughty corner by a lot of countries. So you didn't mention the US as one of the jurisdictions, soon to be looked at, but maybe for the benefit of our nationals there, can you put them into context at all? Is there anything at all you can say to them in terms of when they may be considered to come home, all within the context of everything that's happening around the world and why the borders are closed and balancing the numbers, of course. Also, you mentioned earlier the private charter flight situation, there is an advertisement that's going around advertising private charters, and I don't want to say that private business people are not allowed to advertise. Certainly they are. But would you be at all concerned about any impression being given, which I think you may have hinted at, that, as you said, as it was said, someone could just charter this flight and just fly home on any given day? And under these extenuating circumstances, with people trying to balance loads of information, some of it conflicting, with the Ministry of National Security feel the need to reach out to businesses like the one advertising these private charter flights, have a word with them as to how they may convey their message in this situation. I hope I've put that correctly. Thank you.
Well, we got questions and speeches also.
Correct. Mr. Cox told me those are 3 questions. Let me try to go as quickly as I possibly can. First of all, the United States is not in any naughty corner with us. What I did mention is we have 924 applications currently from the United States. But let me explain something, as I thought I explained a short while ago. An application does not mean it is on behalf of one person. Many of these applications have multiple persons being applied for exemption to come home. Also, these are the applications for exemption that we've entered into our system. They continue to increase on a daily basis. So this does exponentially multiply into thousands of persons and individuals applying to come home. With respect to the United States, we are looking at the potential of flights being allowed and permitted from the United States, the same way we're looking at with respect to Canada and the United Kingdom right now. But as I say, it is really based on the balancing and because of the numbers. So it is going to be, it is currently under consideration, and announcements will be made with respect to that shortly. With respect to private charter flights, there is nothing that the government is doing to stymie anybody's business or anybody's entrepreneurial skills. The message simply is this: you cannot enter Trinidad and Tobago without approval from the Ministry of National Security. We are balancing this exercise based on the resources of the state to quarantine persons on entry into Trinidad and Tobago. So we're not preventing any private charter companies or flights advertised. However, if there's any charter company out there that is telling persons they have an inside track or they have an ability to get persons who use their company into Trinidad and Tobago by getting them approval, I can say without fear of contradiction that is completely false and misleading. And in fact, with respect to something that has taken place, I am going to be asking the authorities to investigate into whether persons were fooled or tricked into paying their money on the basis that by the payment of that money, they would get approval to enter Trinidad and Tobago. So it's quite simply, the message is, until you've gotten an approval by the Ministry of National Security, you can't enter Trinidad and Tobago. Once you've gotten that approval, it's up to you as to how you then find your way back here.
Thank you. 91.9.
Yes, hello, good morning, ministers.
Morning.
Dr. Parasham, good morning. Just 2 quick questions. One is, Minister Young, can you give us some idea of what informs the decision to grant exemptions to persons? What kind of criteria you use? If there are any specific things you look at, whether it's numbers of people, whether the people have tested positive for COVID in the past while they were away, anything like that, if you could identify that and give us some details. And just a quick question on behalf, many bar owners feel like Peter paying for Paul, and there are more Peters than Pauls. And they want to know if there's any intention to get back to giving bar owners a little bit more time to operate some business. Those are my 2 for today. Good day.
Mr. Young?
Thank you very much. With respect to the criteria, what I can assure the population and those who are applying for exemptions, there is a criteria we're using. It certainly has absolutely nothing to do with persons who have tested positive for COVID. We have not denied anyone an exemption or approval to enter Trinidad and Tobago on the basis that they tested positive. In fact, just a few weeks ago, we had someone who was returning from Venezuela. I was contacted, came out of a security briefing to be told by those in Venezuela, as well as our Minister of Foreign and CARICOM Affairs, look, there's someone coming back from Venezuela about to board the plane that's just tested positive, what to do? And I said, well, allow them on the plane, make sure they're in proper PPE gear, if they can, separate them from the rest of the persons. So we're not preventing anyone from coming back to Trinidad and Tobago based on that. With respect, there is criteria that we're applying. I'm not going to say much on that at this stage, because then what you'll find is persons claiming they fall into those categories. There is a very properly identified criteria that we're looking at all the exemptions. It also has nothing to do with the numbers of persons in your party. So, for example, one priority would be those who have small children and need to get back home, newborns, and this type of thing. With respect to the bars, I have been looking on with interest and seeing the threat of litigation and who they've gone to, etc. At the end of the day, the government lives by a very simple principle that's guided us throughout COVID and will continue to guide us, that we will do all that we need to do to protect the population of Trinidad and Tobago. The Prime Minister, the Minister of Health had come out early when we allowed bars to reopen to ask persons to behave in a certain manner, say we'd monitor it. It did not work out properly. We then took a decision and we rolled back 2 hours out of the bar opening hours. I have not been getting adverse reports coming out of the last weekend. So once persons continue to behave, I'm sure that the sub-cabinet committee, Prime Minister, Minister of Health, and myself will take a look at it, and we may then be able to do what we have to do or what is recommended by the medical public health experts based on what is coming to us at that stage.
Thank you very much. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. 3 additional returning nationals from the enchantment of the seas have tested positive for COVID-19 as of yesterday. All established protocols are being implemented. Trinidad and Tobago, the World Health Organization indicated that more than 10 million cases of COVID-19 have now been reported, with more than 500,000 deaths. We have been fortunate so far, but even as the economy continues to reopen, now more than ever, we need to reinforce public health guidelines that offer us protection. In light of the WHO warning that flare-ups are to be expected as countries start to lift restrictions, it is therefore important that we do not become complacent. We must use all the tools at our disposal, not just physical distancing alone, not masks alone, not hand washing alone. We must do it all. The pandemic is not yet over. We have just been spared the brunt of COVID-19 so far. So please let us continue to be vigilant. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19.